Radiologic technologists perform examinations that produce images for radiologists to interpret. The public know it as X-rays, and that is what they are. And we teach students how to perform examinations where patients are positioned and the correct technical factors are made so that you have an X-ray for a doctor to look at. Radiologic technologists could work in a hospital, could work in a doctor's office, could work in an urgent care center, could work as a travel tech, which means they would travel to different parts of the country or the world even where they may be needed, where there's a shortage of radiographers. Or they can also bring X-rays to like nursing homes where the patients can't leave. They'll bring in a X-ray unit and take X-rays there. So there's lots of different environments. So if someone was interested in this particular field of diagnostic imaging, those people who are interested in working in healthcare, number one, really enjoy working with patients, but also enjoy working with technology, who enjoy fast-paced environments where things are not necessarily a typical 9-to-5 day.
You have to be patient, patient with the patients, especially with your peers. You have to be tolerant because not everyone is like you, obviously. You have to be able to listen and then know when to not talk. You have to be able to work in a team. You have to be very independent when you need to be.
One of the core values that are required in this is to critically think, because not one patient's going to be the same, not one situation is going to be the same, and you're going to have to deal with it on your toes.
You're taught one way to take an image, but maybe the patient can't do that, but you still have to get the image. So you need good critical thinking skills. Students become radiologic technologists by enrolling in a program such as the ones that we have here at Montgomery College. It's a 2-year program. It's pretty intense.
Basically, you have to put everything off to get in this program. It's a challenging program, but it's rewarding. When I got in the program, I was like, this is great. Like, you know, you get to help people like when they're most vulnerable. And to me, that's nothing more rewarding than that.
It requires a lot of clinical hours as well as didactic or classroom courses that prepare you to take a national registry. After you take the national registry, you can be hired as a radiologic technologist anywhere in the country. For a first-year radiologic technology student, they'll come to classes on Mondays and Wednesdays, and then they'll go to their clinical sites Tuesdays and Thursdays. As a student progresses to become a second-year student, they will have classes on Tuesday and clinicals on Monday, Wednesdays, and Fridays. Their second summer with us, they are in clinicals every day for 9 weeks.
I did my clinical rotations at Holy Cross Hospital here in Silver Spring, as well as Georgetown Hospital.
As far as my clinical rotations, I went to Holy Cross Silver Spring, and then I went to Holy Cross in Germantown. Then I went to Children's Hospital for a month, and I went to Georgetown University Hospital for my second year.
The clinical experience was very good. They're very familiar with us. They actually, when they hear you're from Montgomery College, they hold you to a certain standard.
The work sites did know that Montgomery College students were well-rounded students, not only in book-wise, but with patient care, and they did exceed that. So I definitely know that that helped me.
The radiologic technology students get 1,560 hours of clinical time. So when they complete this program, they're very well trained, and the sites know this. This is why they like to hire our students or our graduates, because they know the number of hours that they have actually seen them work. When a student graduates from the program, then they sit for the American Registry of Radiologic Technologists, or it's known as the ART, National Certification. After they pass that, and this program has a 100% first-time pass rate for the past 7 or 8 years, so we're very proud of that. But after they pass that, then they go ahead, and depending on the state they decide to work in, they do have to apply for a license. So if you wanted to work in the state of Maryland, you would apply for a license once you became registered as an ARRT certified radiographer. What's really exciting about the field of radiologic technology, it foundationally allows a radiographer to go in many directions. If they want to stay in diagnostic imaging, they can cross-train in CT and MRI, and they don't go back to school for that. Most of the time, it's the clinicals are taught on the job, and you might take a few courses on your own to pass the registry, but it's not a dedicated two-year program. So you can move in that direction, or you can go administratively and become an administrator, go on and get you a four-year degree in healthcare administration, or you can go into education, which is what I did. So it's a really great starting point of a good career that is sustainable for many, many years.
The Montgomery College program, I believe, helped me because not only does it have a good reputation, but it was a stepping stone for me as a student to be able to land a good job.
It's rewarding. The job security is there. You get to learn. You're always learning something. You're always advancing. There's always room for improvement. There's always room for promotions. There's always room to divert into different areas in the medical field. So if I did it, I think anyone else can.